let's go back to the concept of pediatric integrative medicine. As you see here, there are different pieces of the puzzles that contribute to a child's health. And when I see a patient, I try to explain to parents that I can't just focus on one symptom, let's say constipation or allergies, that we have to take into account different pieces of the puzzles that contribute to a child's health. And as you can see, there's a mind-body connection, there's growth, there are relationships, and there's not just a child relationship with the parents, but a child relationship with the extended family, with their school, with their community. It truly takes a village to raise a child, so we have to take into account all those aspects of health, and of course nutrition. So this is the pediatric anti-inflammatory diet. So if you want to just kind of pass it around. A really bad diet can be one of the causes of neuroinflammation, which then turns into behavior issues. Another part of my practice is called functional medicine. This involves certain tests that help me get to the root cause of the problem. As Sandy mentioned, we can have 10 kids with behavior problems. They look very similar. They're hyperactive, impulsive, or they have anxiety, and the causes can be different. So this is what functional medicine is in a nutshell. So there are a couple of tests that are called functional medicine tests that I usually recommend for kids. These are tests that look at intestinal health, at gut health. It looks at nutritional deficiencies, heavy metal exposures, food sensitivities, environmental sensitivities. So after I have those results, it's easier for me to customize the treatment. I have a couple of examples here of how this test looks like. So if you want, you can pass it on and just take a look at them. Every child also has a different genetic background. This is a fairly new science. It's called the science of nutrigenomics. It's still in its infancy, but there are a couple of tests that the results put together with the clinical picture and with the other pieces of the puzzles may also help us customize the nutrition and the nutritional supplements. Some of this tests, for example, 23andMe, you can get yourself. You don't need to get it through a physician's office, and I can analyze the results and give you more information. The other ones, the ones that I showed you, we have to do here in the office. Some are saliva tests, urine tests, stool tests, blood tests. So another thing that I tell parents a lot is that behavior changes in kids, like acting out, being aggressive, being oppositional, defiant, anxious. I call that behavior fever. It's a symptoms like fever when a child has an infection that tells us that we really have to look deeper to see what causes that. A lot of the prescription medication, especially the psychotropic medication, nowadays it really only treats this behavior fever. It doesn't, so we do not treat the underlying cause. The only way to treat the underlying cause is to fix all the deficiencies in the body and then address the stress in the spirit and mind. So what I want to point out is that it's a truly a journey to get a child better. It doesn't happen overnight. You may see some improvement with prescription medication. For example, a child with ADHD